Good afternoon, and thank you for joining me today. I'd like to begin with our weekly reminder about the 2020 census. The response numbers remain at 75% of households throughout Erie County and 61% within the city of Erie. We know these numbers haven't really been budging much, so we need your help to get out there and encourage others to complete the census if you've already done yours. And if you haven't, please get out there and do the census. You can do that by calling 844-330-2020 or go online at my2020census.gov today. Community members also will have the opportunity to complete their 2020 census at the Corey Farmers Market on Friday. And then on Monday, you can go to the Erie Free Store and the Little Italy Farmers Market, both within the city of Erie. Please do your part to help ensure that everyone in Erie County is counted. And now for our update on COVID-19 in Erie County. We have 22 cases of COVID-19 to report today as of 12:01 a.m. This brings us to a total of 891 cumulative positive cases since March. 8 of the 22 new cases are related to required testing at long-term care facilities. We currently have 751 recovered cases, 122 active cases, 16,738 negatives, and we have a total of 18 deaths recorded in the NEDS system. Of the cumulative cases in Erie County, 59% are female and 41% are male. The breakdown by age is that 3% are 0 to 4, 2% 5 to 9 years old, 6% 10 to 18, 16% are ages 19 to 24, 40% are ages 25 to 49, 19% are ages 50 to 64, and 14% are ages 65 and older. Regarding race and ethnicity of the cumulative cases, 57% are white residents, 27% are African American or Black residents, 7% are Asian residents, 3% are other, and 7% are unknown. Regarding Hispanic origin, 10% are Hispanic of any race, with 81% non-Hispanic and 9% unknown. Please continue to do your social distancing and practice good hygiene. Please stay away from anyone that you know is ill, and please continue to wear your mask, even outside, when you go near anyone who does not live with you in your home. Along those lines, we really appreciate the creative ways in which event organizers have approached their events this summer, demonstrating how vital events can be great compromise. Virtual events, can be a great compromise when you hold an event. For example, this weekend is Erie County's Blues and Jazz Festival, and it's live streaming through WQLN to make it that virtual event. Only the producers and the band members are permitted on site. The shared equipment will be cleaned between sets, and the performers will wait in their vehicles with masks being required if they're not performing. So you can tune in to WQLN via radio or television, pull your TV or radio outside, and let the music waft through your neighborhood this year. A little bit different event, but also very fun. Another example that we saw this past weekend was the gathering at Chaffee's Music Festival that took place. That is an event that happens every single year, usually with many, many people coming. And this year they offered pre-sale tickets to a limited number of attendees, keeping the number well below 250. Masks were worn anywhere on the property except if people were in their own campsite. Socially distanced sites were marked on the ground for family units to watch a concert in person. They used hula hoops to make circles for people. Hand sanitizer stations were placed throughout the area, and hand sinks were placed at the restroom areas. So if you're planning an event and trying to figure out how you can do it safely this year, I encourage you to send your plans and contact the Erie County Department of Health in advance of your event so that those professionals there can assist you with providing options, again, that will keep you and all of your guests safe. And now I invite Melissa Lyon, the director of our Erie County Department of Health, to share a quick update. Melissa?
Thank you, County Executive. Today I'll be sharing the information. There's been great public interest and questions around a second wave or a fall resurgence of COVID-19 infections. The timing and severity of a COVID-19 wave in the fall or the winter are very uncertain. But I can tell you the past experiences and what we have learned with the 1918 and the 1957 influenza pandemics point to the possibility of a resurgence. So despite the ongoing response to COVID-19 pandemic, we cannot lose sight of other significant public health issues, including influenza. Influenza affects every country every year, and it takes its own deadly toll. We can be certain that co-circulation of COVID-19 and influenza will worsen the impact on our healthcare systems throughout the nation. Almost nothing is known about the interaction of influenza virus and COVID-19 within individuals. We do not know if a co-infection increases the risk of severity of illness or amplifies even virus shedding. So the Southern Hemisphere influenza season is just beginning, and it may provide some clues as to what we can expect in the Northern Hemisphere later this year. But we must ensure that influenza remains a top priority. The prevention of influenza must remain a top priority. Therefore, my message today is to get people to start thinking about how they're going to protect themselves and their family from influenza this coming season. So one of the easiest ways to protect yourself and your loved ones is to get a flu shot. Our most vulnerable populations, our loved ones, our grandparents, young children, newborn, and those that are immunocompromised are potentially facing one of their hardest seasons. It's the greatest risk this fall, because there will be co-circulation of deadly viruses. And that's very concerning for us as public health practitioners. So the best way to protect those that we care about this year is to wear our mask. We still will need to socially distance. We're gonna have to practice good hygiene. And I'm gonna add one more thing to your list. It's get a flu shot. If you've never or you rarely receive a flu shot, we urge you to get one this year. And if you always get your flu shot, please continue to do so, but also advocate that your friends and family get one too. It's so important this year that we take extra precaution around influenza. Last season and the season before were two of our worst influenza seasons. So we are very concerned what can happen this fall. So again, I just encourage you to add one more thing to your list. Make sure you get a flu shot this year. I hand it back to you, County Executive Dahlkemper.
Thank you, Director Lyon. I'm also happy to welcome Kathy Howard today. She's the Director of Operations at Community Health Net, and she'll provide an update on testing that's taking place at that facility. Ms. Howard?
Hi, thank you, County Executive. At Community Health Net, we have started testing our patients a few weeks ago, and it has gone very successfully for us. We do not test inside the building. We were able to set up a field office outside of our 1202 State Street location and have all of our testing done outside, where we have a negative airflow unit within our office out there. So that way the air is circulated on a rapidly base and is clean for all patients that come in to be tested. Currently, we are testing the majority of our own patients. So any patient that is a Community Health Net patient can come in and get tested with after doing a telehealth appointment with their provider. We have our providers set up to do telehealth as well as in-person visits, but we are still trying to keep anybody that has any COVID-related symptoms outside of the building and to encourage them to do telehealth with our providers. We always have 1 to 2 providers on telehealth only every week. So that way if there is someone that needs to get in to get tested due to symptoms, we can get them in with a provider right away and then get them in to be tested. Right now, we are only testing symptomatic patients. And so that just to go along with the PA Department of Health guidelines and all the other guidelines that there are, is that in our area, it's just testing symptomatic. If there is an individual out in the community that is experiencing symptoms that does not have a primary care provider and does not have insurance, I would encourage them to call us. We can set them up with a PCP and a telehealth. appointment with one of our providers. So that way, if they meet criteria to get tested, we can get them tested. A lot of the time, with the availability for our providers to do telehealth, we're able to get patients tested same day or next day instead of a long wait time for testing.
Thank you so much. And it's great to have another partner as part of the testing being done in Erie County. And I appreciate all the work that your health system does for all the citizens locally. And now I would like to turn it over to the media for questions. And we'll start today with the Erie Times News.
Hi, Chaffee. It's David. A real quick math question on the stats that you gave out a little bit earlier. You said there were 22 new cases. The total cases I have, 891. That's only a 20 case increase from yesterday's number of 871. Can we find out if there was actually 20 cases today or if the number is 893?
The number of cases, I believe, is 22. The math may be wrong on my talkers, but I will try to find out for you.
Okay, because the state health department also reported 891 for total cases. That's why we reported 20 cases for today. So there's a discrepancy.
Well, let me ask Director Line. Let me ask Director Line if she has any clarification on that, because she's in front of her computer and I'm not.
Okay.
Thanks, County Executive, and David, it's nice to hear you. I was actually scrambling to my report here quickly, and I haven't put my fingers on it yet, but we will make sure that we get clarification. I did see two sets of numbers circulating, 22 and 20. I took the 22, I believe, off of the appropriate report, but please stay tuned.
Sure thing, no problem. And Melissa, the other questions for you as well. The letter that was published earlier that you signed and many physicians from around the area signed, asking people to wear a face mask and take precautions. What led to that letter coming out at this specific time? Was it a concern over an increase in number of cases in the last couple of weeks?
That particular letter was agreed upon through the chief medical officers meeting that we hold periodically. They had been weekly, and now we moved them back, I believe, to monthly. And we're following the lead out of the Southwest as well. And if you can imagine, out of the Southwest, they were having a resurgence or an uptick before we were here in the Northwest. We just found that it was prudent to go out with a letter with those statements. I hope that's helpful.
Okay. And is there a concern about the increase in number? How concerned are you about the increase in the number of cases the last couple of weeks?
As for Erie County, Pennsylvania, I can speak that right now they're still manageable, and I like to be able to use that word as they're manageable. We're able to get disease investigators assigned quickly and contact tracing done quickly. So right now, this is manageable. I think we were talking on a phone call earlier today, and I'm looking forward to the day that we have 0 case and another 0 case and another 0 case. So that's the long-term goal. Thanks.
Thank you.
Jet TV.
Good afternoon, Kathy. It's Star. As we get around to the school year just weeks away, how confident is the county that sports can be played safely?
Well, I just want to start by saying that the county health department team has been working diligently with all the school districts, and each school district has their own plan, and we've been helping them with the guidance that's been brought forward on all aspects. And in fact, today there's even a special training going on. But in terms of sports, there's always an inherent risk when you bring people together. It's very difficult sometimes to keep a mask on while playing sports, and there are guidances out there for that. And I'll again see if Director Lyons wants to add anything further onto the sports piece.
The only thing I would add is that we do field questions regularly. We're trying to assist all of those that want to continue to hold sporting events, but the masking and social distancing requirements are very much a part of that. I think the piece that I would add is we have seen or there have been reports that sporting activities are occurring without following those precautions, and that is concerning. So for those that are listening, as you're getting the guidance about masking, even masking in play, if you are spectating, making sure you're social distance and wear your mask when you're spectating. That's going to go a long way for our community and the number of cases that we see.
Okay, thank you.
Thank you, Star. Erie News Now?
Hi. I'd like to follow up even a little bit more on that if I can. In both of your perspectives, both Director Lyon and County Executive Dahlkemper, as we approach school starting here and with school sports potentially ramping up, PIAA meeting today, both of you, your gut feels, are we better off without sports, or is that something you would like to see go forward?
I don't personally have a opinion one way or another, but I do say with caution, we've certainly seen already here on the National Baseball League, for example, an outbreak, particularly with one of the teams, and I expect that you're going to see more of that. Again, you have to think about the people getting together, breathing heavy while they're playing that sport. Do they keep their mask on? Do they not? And as Director Lyon said, I myself have driven around and just go by a baseball field, for example, and seen that the coaches, the refs, the players, the spectators, no one wearing a mask. Those are the kind of things that concern me, because you're bringing lots of people together in a situation that could be potentially very dangerous. So the precautions, I think we need to double down on the precautions when you're in those situations. But I'll let Director Lyon give her thoughts.
Thank you. So the idea of having sporting events either being canceled or delayed, I know it's very disappointing for the community because we do spend a lot of time recreating in that fashion. However, I think you've heard from county executives that as more people are together in that type of activity, we are increasing the transmission of virus among the players and potentially among the spectators, depending on how the spectating occurs. I think the best thing is to really double down, do the best that we can do. We're going to learn as we go forward if we can truly continue to have sporting events, even using the precautions. We will sort of watch what happens on the national platform, and I'm sure the state will take that into consideration and then advise at a local level what happens next. Thank you.
Director, I'd like to follow up on that if I may. Do sports create that opportunity for a super spreader event where you've got a Friday night game, a student doesn't know he or she is sick, infects teammates and opponents, and then they go home, spread it to more people, more students in the school? How big of a worry is that?
I can't speak to if it is a super spreader event or not, or it could potentially be. It'd be difficult for me to say without having good data to back that up. But I can tell you that through our disease investigations, we've not seen this related to any type of super spreading event, but schools are not yet in session, as you've indicated. And so if we have sporting events and then schools in session, even if it's part-time or a limited capacity, it will be interesting to see what happens as we move into the future. Thanks.
And Talk Erie. All right. Joel, are you with us?
Yes. Good afternoon, Mrs. Dahlkemper. Appreciate it. I have a question for you. What is the latest, from your perspective, on the regulations at the long-term care facilities? Are they still, even in the summer, still nearly shut down? And, of course, as you said, it's very difficult for the residents. And if that continues on into the fall, colder months, we're kind of missing our opportunity to have some kind of interaction with loved ones.
So those regulations, as you know, and guidelines are all done on a state level. We don't do that here on the county level. And back, I think it was in early June, I had a conversation with Secretary Levine about this and said we've got to find some way where we can actually see our loved ones in person, and with it being nice weather, I was hoping that we would see more facilities be able to find that way forward. Each facility is making their own guidelines. There's a great story, I think it was Brevalier, that had set up a station where you could come and your loved one was just across the table from you with a sneeze guard in between you, and each one wearing gloves, putting your hands underneath the sneeze guard. You could actually hold your loved one's hands and they could hold yours. And you were close, but you were all protected. I think that was very innovative. I haven't heard there was any issues with them doing that. And I would love to see more facilities finding ways to do that type of interaction while the weather is nice. Having not seen my own loved one who's in a nursing home since early March, I understand how very, very difficult this is on the families, and I would say maybe even more so on many of the people that are in those homes.
Just to follow up, is this another case of the haves and the have-nots where maybe the higher end long-term care facilities are able and they have the wherewithal to do special things like Beverly and some of the more lower end or the middle class kind of facilities can't pull it off?
I don't see that as being the case at all. My own experience and from others I know, it's very random. And in fact, Beverly is the only one I know of, but there could be others that have allowed that type of interaction. But I think if we were creative, it was on TV or something I saw a while ago. This was just a family had some kind of a plastic thing coming down, and they had made arm holes for the grandmother to put her arms in, and the grandchild put theirs in, and they could actually hug each other, and they had a barrier between them. Everyone needs that human touch. And I'm sure the staff is touching our loved ones and hopefully giving them some of that, but there's nothing like the touch of your own family members. So again, I don't believe there's any difference whether you are at a facility that you would maybe consider higher end versus one that maybe not. But I think the care is there at all of them. But I think that it just depends on the administration of that facility and what they feel comfortable with. But I believe the state has allowed for them to be creative and be outside and find these ways. So I hope more do, especially during this last really kind of full month of summer coming up.
Thank you.
And we'll go back to Erie Times News.
Sure, Kathy. This is for you or Melissa, whoever wants to answer this. In recent weeks, have we seen outbreaks? I think Melissa mentioned that there haven't been any outbreaks related to sports. There's been individual cases relating to sports, but not outbreaks. Has there been any events as we've gotten into the middle of summer that have been tied to a particular event or type of event in recent weeks that have led to multiple cases of COVID?
I'll let Director Lyons take that.
So we have daily briefing calls and meetings, and there has not been anything brought to my attention that has been causing a significant outbreak, whether it was an event or a facility at this point. So it just sort of seems that cases are trickling in throughout the community. So nothing unusual to report.
Okay. And then on a different subject, how much pressure is there, Kathy, to increase the seating, and I know this is a statewide decision that has to come from the governor's office, to increase the occupancy rate for restaurants to 50%. I'm hearing anecdotally that the 25% is really tough for local restaurants. Is there a chance that they can go to 50% in the near future?
So I can tell you I haven't been receiving much pressure from restaurants. I think as the weather's good here, restaurants have been very creative in finding some outdoor space. I think many restaurants are also concerned about how they would put 50% occupancy in there safely. And I think anecdotally, I don't have the data to back it up, but it seems like it's helped keep our numbers from really spiking as they did and and they continue to, for example, in the Southwest Pittsburgh area. And so I think right now it's a good thing to continue doing. I understand how difficult this is for businesses, restaurants particularly. Really any business that the basic premise of the business is that people come together, those are tough businesses right now. But again, we want to keep people safe and keep people from getting sick and keep people alive. So with that being said, I think our businesses are trying to do the best they can. And I personally haven't gotten that much pressure to fight to open the businesses up more. Okay.
Thank you.
We'll go to Jet TV.
Hi, Kathy. On that same topic, where is the county council members in regards to the CARES Act grants? I know that they were working on it and researching a little bit more. Any new update on where they are and what people can expect for those who are trying to apply for that sooner than later?
So I have encouraged county council to try to move along with this as quickly as I can, feeling confident in what they're voting for, because every day that we delay is another day we don't get money out to the small business, to the nonprofit, to the entity who is really suffering out there. And we need to get this money out by December 30th, so we have a very, very short window to get $24.3 million into the community, which I think will go a long way towards helping our economy. So I encourage County Council to understand the task force has been working diligently on this for almost 2 months. Much research has gone into the proposal we put forward, and I asked them to vote on it sooner rather than later, but I have not heard yet when they're going to hold their special meeting. And I hope they don't wait till the 11th of August, but that could be a potential date that they would vote on it also.
Okay, thank you.
Sure, Star. Erie News Now?
Hi, I'd like to follow up on the 25% capacity rule with restaurants. We had owners of 3 different restaurants on our news last night talking about how difficult that 25% rule is. What is your message to business owners who are going through this, who feel like they're kind of taking the brunt of this here, paying for the situations in other parts of the state where cases aren't manageable like they are here? Just your message to them as things stay relatively stable here, and yet they're losing business.
So we need to keep our numbers low in Erie County. In fact, as Director Lyon said, we would love to see the day where we have days in a row where we have 0 cases. People need to be wearing their masks. People need to be staying socially distant to keep our businesses open. And if our numbers would spike a lot, what we'd have to do is close down those businesses, and we don't want to do that. So we're trying to keep the businesses open as much as possible. Again, we have this window of time where the weather is good, and I understand, again, how difficult it is, and this is the virus. This is not the state or anyone else who's causing this to happen. It is the virus that is causing this to happen. And the virus is tricky, as we've said. The virus is always out there looking for its next host. And when you bring people close together inside, that's a very dangerous situation, especially if they don't have a mask on, and you cannot wear a mask and eat. So that makes the situation inside restaurants very, very difficult. And as much as I empathize and sympathize with these businesses, we have to keep the public safe. So if they would encourage all their employees and all of their customers and their neighbors and their friends and everyone else, and we would all do this, and we would all wear our masks every time we're outside of our home and not with others that we live with, we really could get to those days where we would have 0, 0, 0, one day after the other, and our kids could go back to school and be safe, and people could go back to restaurants and be safe. Other countries have done this. Other countries are back to much more normal living than we are, but we have not done those very simple things that we've been asking people to do for many months now. And until we do that, unfortunately, we're going to be in this situation. Talk Erie?
Yes, hi. This is a question for Director Lyon. Melissa, one of my Talk Erie listeners is asking about what the health department is doing to protect the public from the toxic hand sanitizers that have the different kind of alcohol that are infiltrating in from foreign countries. Is there an action plan for that locally?
Thanks for the question, Joel. I'll be honest, that's not really been on my radar screen or in my conversations. Typically, if there are recall products, that usually comes through the FDA's website and recalls happen, but it sounds as if this might not be going through the normal chain and therefore maybe going unidentified. So I really can't speak to it beyond that at this point.
Okay, yeah, they were saying that, just like most of us, when they enter a facility, they're looking for hand sanitizer because they just touched a door, and what's out there is that other kind of alcohol that is actually very dangerous to the skin and to people. So thanks for the answer. I appreciate it.
My advice would be to carry your own little hand sanitizer. Get a little bottle. You put the hand sanitizer you don't react to, and keep that in your pocket or in your purse. That's what I do. Keep one in my car. So I utilize that a lot. So I just would recommend that to people. Erie Times News, do you have any last questions?
Yes, just an update. We've known about the high school athletes that have tested positive out of Fairview and McDowell. Have there been other high school athletes that have tested positive?
I'm going to turn that over to Director Lyon. If she has more specifics on that, I'm not sure.
I don't have any additional information about positive athletes, David.
All right, thank you.
Star, Jet TV, do you have any final question?
Yes, Kathy, one final question. Is the county going to enforce the 250-person rule at sporting events? And any complaints about the Erie Speedway's car events that they've been having over the weekend?
So I'm going to allow Director Lyon to speak if she knows anything about the Speedway, because I'm not really sure about that. And but we are enforcing 250 person events. I will tell you the Chaffee gathering was one of those that we had inspectors go out and just to make sure that we had given a food permit, and they were doing everything as they had said they would, and they were, and that's what we love to see, and we love to see entities like that following the guidelines, doing the best they can. And I'll have Director Lyon speak to the Speedway if she knows anything about that.
I don't have additional information about the Speedway as far as complaints coming into the complaint line. Typically, those are discussed on a daily basis. I'll be honest that today's meeting was sparse because we had individuals out of training. So I don't have additional information on complaints on Speedways. But I can tell you that every complaint that comes in is investigated. Just as the county executive had indicated, we received complaints over the weekend as well. And we investigate those, and I was very happy to report that this past weekend's investigations resulted in, we were unable to confirm that complaint, and in fact it was the opposite. So sometimes complaints do result in compliance, and we're always glad to see that. So just because it's a complaint doesn't necessarily mean they're not in compliance.
Thank you.
Thank you.
Erie News Now?
Final one, just looking for some clarification. Reported 18 deaths today. The state reports 15. Just wondering why the discrepancy there.
I'll let Director Lyon speak to that.
Sure thing. So there are two death reporting systems. There's an electronic death registry system, and then there is the NEDS electronic disease surveillance system. They categorize deaths differently, meaning depending on the death certificate where the COVID-19 complication is listed, results whether it gets counted as a death or not. So in reality, I can tell you that there are at least 18 COVID-related deaths, and it's just a way of looking at data differently in which system you're reporting out of.
Thanks.
And Talk Erie, final question.
Yes, and anybody could answer this one. Why do you think there is this discrepancy with more females getting COVID than males? Does it have to do with the type of essential work that people are doing and they're getting COVID that way? Because it's not intuitive that there be more female cases in Erie County from the whole party thing and the family gathering thing, but maybe, what's your thoughts on that?
I don't have any data to back anything up, and as we saw in the beginning in China, it was actually more males, many more males than women. Right. And so I had read somewhere that a lot of men smoke in China and most women don't. I don't know if that had anything to do with it. So I think this will be something that the data people and the epidemiologists and such will be looking at even more in depth as time goes on. Director Lyon may have something else around this. I'm not sure, so I'll let her chime in.
Yeah, I think this data puts you in a position where you want to speculate is what's happening, right? And so speculation is probably not a great place for me to be in. So I don't want to speculate anything around that. I am interested in what we discover as time goes on and we take a look at that data. Our numbers are small. It might be a bit of an anomaly here. But I'm sure as we go back and review data and really look at each case and the nuances around each of those cases, we learn more. And I did want to also circle back around to David's, thank you for finding the error in our ways for the 20 cases versus the 22 cases. I have an internal staff member that said, oops, that was my fault. It is 20. So our apologies are extended. It's 20 cases today. So thank you.
Thanks, Melissa. Appreciate that.
Yes, thank you, Director Lyons, for getting that clarified, and thank you, David, for bringing that forward. You know, everyone's human, and we try to get the right numbers out there, and we're always fixing the data as new data comes in as clarified. So as with those 2 deaths records, one saying 15, one saying 18, again, data is only as good as, I guess, a lot of factors around that. I have a friend who's a big data geek. She's probably listening now, and she always tells me, you know, the data's got to be right, which I agree with. So thank you, David. There's been a lot of talk about sports today, and so I do want to talk about one of our star players, which has to do with sports, and that's Elk Valley Golf Course. Now, golfing has been shown to be a sport that most of us can do very safely if we take the proper precautions, and they're definitely doing that out at Elk Valley. They have a bold sign on the door that says that their masks are required. They spray painted masks in huge letters in 2 places. They have garbage cans making a barrier to the door so that nobody can go inside. They have porta potties set outside the door, and then all transactions are done from a takeout window. And then they sanitize the carts after each person's use. So thank you to that star player, and those of you who want to get out and golf, you know, go to a place such as Elk Valley, and I'm sure other golf courses are doing well too, but make sure you're comfortable with that business that you go to, and if you're not comfortable, go to someplace else where they're actually following the guidelines and doing all the right things. Most of our businesses, as I continue to say, are really striving their best to follow the guidelines and provide for you, their customer, the best possible experience in the safest possible way that they can do that. So in the meantime, let's all of us do our part by staying 6 feet apart, keeping our social distance from those people we don't live with, washing our hands with soap and water for at least 20 seconds, using hand sanitizer when we cannot get to a sink and soap, sanitize surfaces regularly that are high touch particularly, and always wear your mask when you're outside and near people that don't live with you in your own home. So I ask you to please continue to limit your goings and stay close to home. Please stay safe during these days, and please stay calm. I look forward to talking to you again next week. Thank you.